You can hear? Yeah. Hi there, I'm Christine Bentley in studio with Sharon Caddy. Now, we all know how important it is to protect our eyes from the sun's harmful UV rays. But what about the effects of blue light rays? Joining us in studio to help us with this subject is blue light specialist Dr. Ken Mandadakis.
Mandadakis?
Mandadakis, you got it. Welcome to the show. And the first question I have is, what is blue light?
Blue light is part of the visible spectrum that we have in our light, in our environment. And when we look at a spectrum of light, blue light is going to be short wavelength, high energy, closest to ultraviolet light. And the shorter the wavelength, the higher the energy, the more potential damage that we can have from that light.
So where would this occur in my day-to-day life?
It'll occur everywhere and anywhere. So if you're looking at a video screen, if you're looking at a telephone, an iPad, an iPod.
Is this the same kind of light I've seen when they're using it for like teeth whitening and all that kind of stuff?
That'll be a different wavelength.
Oh, okay, because it was blue. I thought I'd ask.
Yeah, usually when you do that whitening, you'll get the yellow glasses on to protect your eyes from that.
Okay.
So where is the increased exposure coming from? Is just because we're in front of tablets all the time, or in front of cell phones all the time, or TVs, or what?
So any type of video display terminal that we have, be it a television, an iPad, a phone, anything of that nature, will add to our exposure. So we get it naturally as well from the sun, and that amount of exposure that we normally get is good for us to a certain extent. Like everything in moderation is necessary.
So what are the ill effects, though, when we start to get too much blue light? How is this affecting us negatively?
So there's been a lot of studies that have come out in the past years showing that excess of blue light will affect our melatonin levels, will affect our circadian rhythms, which are helpful in our sleep cycles, increasing risk of certain types of cancers, increasing issues with sleeping. Those types of things are very much evident.
Well, now I'm really worried. So, I mean, what am I exposed to that I need to eliminate? Like, how dangerous and is it? I mean, I'm exposed to an iPad every day, a cell phone every day, a TV every day. Am I at a danger level? How would I know?
Yeah, so the problem becomes it's difficult in our current environment to get away from those types of devices. They are everywhere and anywhere. As adults, especially with sleeping, for example, as adults we could always find ways to calm us down, whether it be exercising before bed or having a drink or doing that kind of thing. But with children become a little more difficult to get them off their iPods, get them off their iPads, because sometimes they're used as a reward for having a good day in school. And it's recommended that we try to get our kids off these types of display terminals an hour before bedtime.
So when I'm just trying to wrap my head around the whole thing. So when we are talking about the blue light and about the effect on our sleep, our circadian rhythm, is it giving us an artificial sense of daylight? Are we not getting those signals to our brain that tells us it's time to shut down? Is that what it is?
Correct. So our brain is continuously thinking that it's still daytime because our melatonin levels are being suppressed. Melatonin is a chemical in our body that's produced primarily in the gut, and if we continuously think that it's daytime, the melatonin won't be produced as much and will not be absorbed as much, so then it will affect our sleep cycle.
So besides sleep cycle, the thing that tweaked my interest was cancer. So, I mean, obviously in high levels it's dangerous. How do I test for that, or how do I protect against that?
Well, there were studies done a few years ago with doctors and nurses who were working shifts, and they showed that those doctors and nurses who worked the night shift, because they never had full darkness and their melatonin levels were never properly aligned, they were at risk for higher levels of cancer. So it didn't cause cancer; they were just at higher risk for it. So what we need to do is, try to get the children especially to sleep without a sleeping lamp or a night lamp. Try to make a dark environment, and again minimize our exposure. So instead of always reading a book on the iPad, maybe go back to a
real
paper
book.
Yeah. So it's not like, I mean, there are machines, for example, that can scan your skin for UV damage, let's say. But there isn't a test like that for blue light?
There is no test because it won't leave any residual effects on us.
So it doesn't burn us or anything like
Nope.
the other kind would?
It will not burn us. The only thing it does is a symptomatic effect in terms of all the things that we spoke about.
What about when it comes to our eyes? Because obviously this is where we're getting the direct effect, is right into our eyes. How is that affecting us that way?
Right, so the sensors, the cells in our eyes are what sense how much blue light there is and whether it's daytime, nighttime, and then sending the signals to the brain to continuously regulate the things we need to do. So one of the things that we can do is protect our eyes from the blue light, and there's various types of glasses that can be used with tints and coatings to reflect some of the blue light that's being absorbed.
So a normal sunglass wouldn't?
A normal sunglass can. Unfortunately, it's difficult to wear sunglasses inside. It's difficult to wear sunglasses at nighttime. So wearing a clear lens with a prescription.
See, like a filtering system then.
Absolutely. Whether it's going to be filtering or reflecting, we can't completely get rid of the blue light in our environment because, again, it is necessary to some extent, but minimizing the amount that we're absorbing.
What are the positives, like the positives for the adequate amount of blue light? Like what's the good part of it?
So again, adequate amount of blue lights will help your circadian rhythm. It'll actually make you feel better. It'll help with seasonal affective syndrome. So this time of the year now with winter, that lack of light will make us feel a little depressed, a little bit sad. So having some amount of blue light is actually good for us. It's the excess that's the issue.
So let me ask you, I remember years ago friends of mine buying machines in the winter, and they would sit in front of the machine to get 20 minutes of light because apparently they weren't getting enough light or sunlight. And was that a fallacy?
So years ago, the computer screens, if you recall, were not these flat LEDs. They were more of the curved, the tube. So they weren't emitting as much blue light as we are now. So yes, those machines were not a bad thing to do for the 20 minutes. But nowadays, all of these screens are very bright, very LED, and producing a lot of that blue light.
And we like all of that, but I guess it comes down to what's going to come down to is discipline. We have to discipline ourselves to understand that too much of a good thing is too much of a good thing.
Absolutely, and I've always said everything in moderation. So when patients ask with regards to vitamins, minerals, and nutrients for the eyes, everything needs to be done in moderation. We shouldn't be doing anything in excess.
So the symptoms that you would point out, because you say there's no residual mark on the body that you can test for, are things like sleep and mood, sleep and mood and...
Right, so I deal a lot with children as well, and children with autism spectrum disorder and other behavioral issues. And speaking to parents, the one thing they always say is that the sleeping is an issue. And a lot of times kids on the autism spectrum will have intestinal problems, which means that they have less melatonin to begin with. And just putting them on a low-dose melatonin supplement, and then minimizing, again, an hour before bedtime, no iPads, no iPods, eliminating that as a stimulus as well, and it has some pretty interesting results.
Well, there you go, Ken Mandadakis. Thank you so much for coming in and sharing this information with us, which we can all use. And if you're not sleeping, Christine, this could be your problem.
This could be my problem. I mean, now I've discovered blue light. Oh, my goodness, another thing to be worried about.
Thank you for having me.
Oh,
Thank you so much. And stay with us. Coming up after the break, we're going to check in with Kimothy Walker and Capital Connection on what she said on SiriusXM Canada Talks.
Thank you so much.
Oh, thank you.
I just, sometimes you get that